Hey everyone, Dr. Peterson here with Regions EMS for today's daily COVID update. Today is Friday, April 10th, 2020. I'm sure you're sick of hearing me say this, but information presented today is only valid as of today, April 10th. We make no guarantees it'll even be valid later today. Things have been changing rapidly. We'll keep you up to date. Check into our website, regionsems.com, click on the COVID link, and you'll find a page full of resources and information, as well as videos, frequently asked questions, and it's all time-stamped so you can be sure you're getting the most recent information. Let's move on to some statistics for today. Worldwide, we're just over 1.6 million cases with 97,264 confirmed deaths related to COVID-19. Here in the United States, the CDC is reporting just over 427,000 confirmed cases. Obviously, the number is much higher, but we're accounting for almost a third of the worldwide confirmed cases right here in the United States. And we're approaching 15,000 US deaths as well. Minnesota, we're seeing 1,242 confirmed cases and 50 deaths. And then across the river in Wisconsin, 2,885 confirmed cases with 111 deaths. Fortunately, as I mentioned on Wednesday, both Minnesota and Wisconsin are seeing a linear growth rather than an exponential growth. So all of the social distancing, masking, precautions that we're taking, they are making a difference and we are flattening the curve. The latest projections that I've been seeing, I heard one that said maybe peak hospitalization rate will be pushed out to June in Minnesota. Other models say that we're 13 days away, April 23rd, from the peak resource utilization based on the current models. Who knows? Anytime in the next 2 to 8 weeks or longer, if we flatten the curve, hopefully we can get back to a normal life well before that hits, assuming that we're doing all the right things. All right, a couple things for today. PPE is limited. Obviously, that's kind of everyone's fear right now. We don't know what's going to happen, when it's going to run out. It is okay to reuse a mask, at least until it's damaged or visibly contaminated. Both the surgical face masks and the N95s can be reused throughout a shift. And if you take good care of it, possibly even across shifts. Just want to mention that there is some work being done right now, some research by 3M. I've also heard from the Mayo Clinic in Rochester. I can't speak to other healthcare systems. Looking at how can we decontaminate these masks and reuse them. Some of them involve some chemicals like concentrated hydrogen peroxide, some concentrated even alcohol solutions, moist heat for a prolonged period of time. So there's some work being done. We'll let you know as soon as we get any recommendations from our organization when we hear back from 3M on the results. So that is on the horizon for now. Just reuse the masks at least until they're contaminated or damaged. Kudos to everyone on wearing your mask. We've had some of our staff, our physicians, clinical supervisors out and about and have seen people wearing masks in the ambulance, in the fire engines, at the stations. You're doing the right thing. I know it's inconvenient, it's goofy, it's frustrating. This whole thing just sucks, let's just be honest. This has just turned everyone's world upside down. We don't know what day it is, we don't know what's going on, when is this going to end, but you're doing the right thing. We are limiting the spread of this virus. We are saving lives through the actions that we're taking. So keep it up, stay with it, stay strong. We have also released, we've been working with our occupational medicine physicians at Regions Hospital to look at what happens when you as a first responder are exposed to COVID-19, either through a patient or through a coworker. And we've been looking for some guidance and we leveraged our experts and boy, they really stood up on this and did a lot of work. Dr. Burnett was our coordinator, liaison with them, and it's finally been approved. So it's on our website today. I would encourage everybody, whether you're in leadership at your agency or frontline or health and safety officer with your city's EOC. I think there's some excellent information in here on things you can do to protect yourself, what to do if you've been exposed, who to call, how to work through the process to possibly get tested if you qualify for testing. But the most important thing in the back is an algorithm that talks you through and stratifies the risk of your exposure into anything from very low to high. And then what do you do about that? So let's say you have a medium risk exposure. What do you do? The big question is, do I need to go home? Do I need to isolate, quarantine? And based on the algorithm and the guidance from the CDC and our occupational medicine team is that only the high-risk exposures need to isolate and quarantine. So anything up to a medium risk exposure can continue to work. Obviously wear a mask, monitor temperature and symptoms, use precautions, but can still continue to work until obviously you develop symptoms. And then at that point, it's a completely different ballgame. One thing that I should mention on the algorithm, if you look at the top, one of the first questions is, was the patient wearing a face mask? If the answer is yes, then the highest your risk would go is medium. So one of the best things you can do is get a mask on the patient right away, because even if they cough in your face through the mask and you weren't wearing any PPE, the highest your risk for that exposure would be is medium, which means you don't need to leave work, you don't need to isolate or quarantine. So that's one way we can keep our public safety workforce in place, is by getting the mask on the patient right away. Obviously wearing our own PPE is important as well, but there's some other guidance in there. You know, what if one of your coworkers tests positive? What does that mean for everyone else who has been working with them? I know a lot of you have been asking for this recommendation, and we've leaned on our partners in occupational medicine to provide that, and I think that's a great resource that you should all be familiar with. And then kudos to ED staff. I know we talk a lot about pre-hospital providers, first responders, but I think that this has really turned everyone's world upside down, and at least here in Minnesota and western Wisconsin, we're seeing low volumes. Everyone's just waiting. We've done planning, we've ramped up, we're hearing all these reports from other places, and we're just waiting. We don't know when it's going to hit, how bad it's going to hit, and I think everybody in the emergency services, whether you're in the hospital or out of the hospital, has been very adaptable, very flexible, and diligent too. So we are making a difference, every single one of us, from the ER nurse, physician, PA, tech, coordinator, registration person, to paramedic, first responder, EMT, police officer, firefighter. We're all in this together. We're all doing the right thing. And I just want to leave you with that for the weekend. Keep your chin up. We're doing good work, and keep it up. Let's go back now to some trivia from last Wednesday. Our question was, in what decade were the Coronaviridae discovered? Several replies, and I'm going to give a shout out to Larry from Bayport Police, who I think one-upped us on this. The answer was in the 1960s. The virus was cultured from humans and identified, but Larry says that actually it was discovered in chickens in the 1930s. So technically, I guess you could say 1930s is the right answer. I didn't qualify the question by saying in humans. So well done, Larry. Also, Chief Hines from Scandia Fire, and Linda from Northland Ambulance. Linda's been a consistent contributor to our trivia and Ben writes most of the time, so congratulations to you, Linda. Let's move ahead to our question for today. Please submit all of your guesses to regionsems@healthpartners.com. We read all of the emails, we read all of your feedback. You know, even things like see something, say something. You're concerned about something that's happening with this pandemic. Please let us know. We will explore it. We will run it up the chain of command. We will look into it and get back to you. But for now, trivia questions, anything lighthearted. Love to hear some of the good things that are going on out there right now during the middle of this crisis, whatever you want to call it, pandemic. So question for Monday. There's a mathematical term called R0, the letter R and then a sub-zero. That it's calculated out to be the infectiousness of something. So if one person who is infected by a virus infects one other person, the R0 for that virus would be 1. If each infected person infects 2 other people, the R0 would be 2. So anything greater than 1 means a virus is going to spread. Anything less than 1 means it'll eventually die out because fewer people are being infected from each infected person, if that makes any sense. You can Google that to verify my facts here. Anyways, question is, of all of the recent pandemics, and recent meaning in the last 1,000 years, what infection, virus or bacterial or otherwise, has the highest R0 value that we have discovered? I think this will be a little bit interesting, so submit your answers, regionsems@healthpartners.com. Otherwise, take care this weekend. Get outside, get some vitamin D, enjoy your family. Maybe not friends, we still have to social distance, but just do something, take care of yourself. All right, stay safe, stay healthy. We'll see you on Monday.